My name is Sarah White and I'm the Director of Quit Victoria, very proud collaborator of the Achievement Program. I've been asked today to talk about a few of the common questions we're getting about smoking, use of e-cigarettes or vaping, and coronavirus, and some things that you can do to help improve your health at this time. Well, actually, now is a great time to quit. Not just because of a potential increased risk with smoking and vaping and coronavirus infection, but also because we're about to enter our influenza season. And we know that smokers have a much higher risk of getting influenza and other types of respiratory illnesses. So now is a really good time to quit for your immediate health concerns. But you've also got some really great circumstances around you right now that will help you quit too. So there's the motivation, obviously. There's a motivation about saving money, but you're also a little bit now separated from those things that we know people have really common relapses. So going out and having drinks with friends, which we'd all love to be doing right now, but we can't, make that work for you. At the moment, we don't have enough evidence to be absolutely definitive about the link, but we do know that people who use cigarettes or e-cigarettes have reduced lung function, so the cigarettes and e-cigarettes cause inflammation in the lung, and we also know that they increase the susceptibility to infection, both through that reduced function, but also because both of these products appear to basically compromise the immune system, which means that if you do catch the virus, you're more likely to develop the COVID-19 disease, and you're more likely to have a worse outcome from that disease. You're more likely to get complications from the disease. Because there are a couple of other things around cigarettes and e-cigarettes, and also the use of water pipes, so shisha, hookah, that we need to consider. And the first is that when we're using those products, we're actually doing a lot of hand-to-mouth action. So anything on the hands is going to be quickly transferred to the face. The other thing too is, of course, sometimes people share these devices. So in this time, really important not to be sharing cigarettes or lighting cigarettes for other people, not to be sharing e-cigarettes, not to be using water pipes, because all of these things are direct contact routes for the virus. If you are a smoker or using e-cigarettes, please take extra precautions around the advice that you've already received. Coughing into your elbow, lots of hand washing, being really conscious about not touching your face. But ideally, the best thing is to try and quit. One of the things we're particularly worried about at the moment in the current circumstances is that we have a lot of people who are essentially confined to home, and we have kids who are home from school. And what this means is we've got a situation whereby someone smoking in or around the home is potentially exposing their kids to secondhand smoke. Secondhand smoke is dangerous for kids for a few reasons. The first is that they increase middle ear infections, they increase wheezing and asthma attacks. They also increase the risk of kids getting a respiratory tract infection. And of course, that's particularly a concern when we're about to enter flu season and we have coronavirus around. So not smoking around kids is really, really important. But the other thing, of course, is kids are going to be seeing their parent or parents or the adults around them smoking. And the biggest predictor we have of kids smoking when they become teens is whether they have a parent or a significant adult in their life who's smoking. So this could be a really good time to be conscious of the role modelling that you're displaying in terms of smoking, and to look at how you might quit as a great sign of strength as a role model. The benefits of quitting smoking and quitting e-cigarettes are absolutely huge. So smoking has been the leading cause of preventable death and disease in Australia for a very long time now, and remains the leading cause of preventable death and disease. I'm not going to list all of the diseases and problems that smoking causes because I think we're all fairly well aware of them. But a lot of people don't think about the benefits of quitting, and there are a lot. In fact, your mental health starts to improve fairly quickly after you've stopped smoking. Your blood flow around the body improves almost immediately. Your sense of taste and smell comes back in a good couple of weeks, and your lungs start to clear as well. 2 or 3 weeks, and your lungs have actually already gained a good bit of function that they otherwise didn't have. So there's lots of health benefits around quitting. A lot of people who smoke tell us they really enjoy knowing that they don't smell of cigarette smoke. They enjoy, or they come to realise that they did have that smell of cigarette smoke around them. Their clothes smelled of cigarette smoke. A benefit of being able to smell better as you realise what your clothes might smell like. People will talk about not having stained fingers as a really big advantage. But I think the thing that's really by far and away the biggest incentive at the moment, other than health, is how much cigarettes cost. So as someone who's smoking a pack a day is probably spending around about $4,000 to $5,000 a year. That's a lot of money that could be in a household budget, and we all know that household budgets are feeling the strain these days. So quitting will not only improve your physical health and your mental health, it will also improve your household wealth. Call the Quit Line, free, confidential, non-judgmental, very supportive group. They are experts, but they're not going to be telling you what to do. They're not going to be telling you to quit even. What they'll do is they'll talk with you and help you identify your own triggers and your own habits, and help you develop a personalised plan that you can apply in your situation that's going to help you break some of those triggers and habits.